നമസ്കാരം. സൺറൈസ് മെഡിറ്റോക്സിലേക്ക് സ്വാഗതം. ആനുകാലിക മെഡിക്കൽ വിഷയങ്ങളെക്കുറിച്ച് ഒരു ചോദ്യവും അതിനുള്ള ഉത്തരവും. ഇന്ന് നമുക്ക് അതിഥിയായി എത്തിയിരിക്കുന്ന കൊച്ചിൻ സൺറൈസ് ഹോസ്പിറ്റലിലെ സീനിയർ കൺസൾട്ടന്റ് ഫിസിഷ്യനായ ഡോക്ടർ ഷീതൽ ബിനു ആണ്. ഒരു വ്യത്യാസം എന്നുള്ളത് ഇന്ന് സംഭാഷണം ഇംഗ്ലീഷിലായിരിക്കും എന്നുള്ളത്. നമുക്ക് ഡോക്ടർ ഷീതലിനോട് ചോദിക്കാം. So welcome Dr. Sheethal.
Thank you.
There is a lot of hype of late about treatments of COVID-19 becoming available. So can you tell us in brief, like what COVID-19 treatments are coming up in the market? Is there a solution for the people's question, COVID-19 is treatable?
Okay, so at the outset, let me tell you that there is no tailor-made treatment available for COVID-19 as such. But as of today, there are a lot of drugs which are already available for other diseases which are being repurposed and being used for treatment against COVID-19. The commonest one which I can start with is hydroxychloroquine. So this has been a controversial drug, but I will not go into the controversy part of it. The fact today is that it is been advised by ICMR to all the frontline workers to take it as a prophylactic drug. Now, by prophylaxis, it doesn't mean that it will prevent the infection, but it will cause a milder variety of disease. Now, it has been proved in small studies. A large study is now underway in which a lot of healthcare professionals and police officials and staff, nurses and doctors, all of these are enrolled, and we are likely to get the study by the end of July. So after that we will see whether ICMR relax the guidelines and involves more people. This was about prophylaxis of hydroxychloroquine. Now,
are the tablets that we are using now, any antibiotics, anything that we are
yeah. So hydroxychloroquine as combined with azithromycin, which is an antibiotic, as you said, it's a macrolide antibiotic, and azithromycin as well as chloroquine combination has been found to be effective in a lot of studies published from China and then France. So it reduces the viral load, and so a combination of these drugs, though it is controversial because it can cause a serious side effect like QT prolongation, which can lead to serious ventricular arrhythmias. So that is leaving the controversy part aside. This is a common drug which is being used in many parts of India, and in India doctors are very familiar with the drug because we have been using it for the treatment of malaria and rheumatoid arthritis for a very, very long time. The drug doses as compared to the international standards have been very low in India. We are prescribing very low doses of drugs, so we have not seen as much side effects as mentioned in those trials. As of now in India, hydroxychloroquine and azithromycin are being used very cautiously with continuous monitoring of the QT interval. So this was about hydroxychloroquine, and the other drugs are antivirals. So antiviral drugs, the first thing that comes to mind is lopinavir and ritonavir, which are being used for HIV. So these two drugs have some of the studies show that they are showing good results in COVID, but some of the studies show on the contrary. So now it is being included in the big trial which is called as a solidarity trial, which is a multinational trial with at least 100 countries which are involved in the trial, and one of the arm of this trial is this lopinavir and ritonavir combination, the other being hydroxychloroquine, the third one being remdesivir, which is an antiviral, and the fourth one being this lopinavir ritonavir combination along with interferon alpha. So a head-to-head study of comparative studies going on in this trial, and again the results are awaited.
Yeah, that's great. So as you said, there's lots of talk regarding remdesivir being manufactured from India. So what can you highlight on remdesivir?
Yeah, so remdesivir is not a new drug. Actually, it was first synthesized in 2013-14 during the Ebola. It was in fact treated a treatment for Ebola virus, and later on it was also used against. It was very effective against SARS and MERS virus, which both of them are coronaviruses. So hence it has been tried in the COVID-19. Yeah. So in COVID-19 they have conducted a study in the US which was published in the New England Journal of Medicine. So what they found is remdesivir reduces the hospital stay of a patient by 4 days. as compared to the standard of care medicine. So they found that it was effective in reducing the viral clearance. It's an antiviral drug, so it stops the replication of the drug or helps in reducing the replication. So they found it effective, but this was a preliminary study, and final study was completed on 25th of May. The results were published. What they say is now that remdesivir is effective in mild to moderate cases, but in severe cases it doesn't show any significant difference. That is, it doesn't show any reduction in mortality. So what they're proposing is that remdesivir should be combined with other antivirals or other group of drugs, anti-inflammatory drugs, to reduce the mortality.
That's great. So that's great news in it. And also people are talking about plasma therapy. So you have, what do you have to say about plasma therapy?
Yeah, so the thing is that a person who has already got an infection and recovered from a COVID-19 infection will have antibodies against the virus. So the plasma of this person with antibodies is now transfused to a person who is suffering from COVID-19. So it will help to boost up the immunity. So it's an additional benefit. But ICMR, that is the Indian Council of Medical Research, has made strict guidelines to restrict it to only severe cases of COVID.
Sure. So there's definitely hope for a lot of medications.
Yeah, I'm sorry, I just wanted to mention one more drug. That is, it's an immunosuppressant. It's called as tocilizumab.
Yeah.
That is showing quite good result. It has been tried in Bombay and Delhi in many hospitals, and they show that the results are very promising. But the drug is very expensive.
Any other new drugs or antivirals are coming up in the market?
There's an old drug, as I told you previously, they are being repurposed for it. So there's an anti-flu drug, which was previously made in Japan. It is now being manufactured in India. It's called favipiravir.
All right. Okay.
And now at least 10 hospitals have been enrolled in a trial to look at the efficacy of the drug.
So that was really great information, Dr. Sheethal, for the audience. So it is really nice having you on the show. So now we know that there is a lot of researches coming out, and there are a lot of drugs, that is a handful of drugs that is available for COVID-19. So there is a lot of hope. At the same time, it should always be used with caution. So with that, signing off. Thank you so much.